listening to, watching, hearing, smelling, tasting, and feeling sex, drugs, and skincare. Like and subscribe. Hey, welcome back to Sex, Drugs, and Skincare. And this is weird. I have headphones on.
You mentioned your ears were cold earlier. Right?
I did, and now here we are.
Mm-hmm.
I am Nicky Davis Jr., stand-up esthetician and licensed comedian. Yep. 25 years of the esthetician work.
They've been sending those, you know, like you have the CE credits, the continuing education credits.
Yeah.
They've been sending them for your stand-up license. You're supposed to go in and have a refresher course on the new techniques of comedy.
Oh, yeah.
And they're really making some advances in the field of comedy.
In which part? Oh, in the comedy?
You don't have to wait quite as long to go on stage.
Okay. And the jokes are getting, you have a lot more time to not get the laughs.
And now when people do crowd work, it's just the audience doing material in the audience. And you have to sit there and either laugh or not laugh at them.
Wow.
So, yeah. But I just want to let you know that you have those available if you want.
Maybe I could sign up for some adult education.
Mm-hmm.
Something like that.
Like night school?
Yeah, night school. Yeah, exactly.
Yeah. So you're board certified. No, sorry, you're just bored.
I'm just bored. I'm not certified, except for I'm a stand-up esthetician. Or not I'm a licensed esthetician for 25 years.
You can't stop it.
I know, I can't. The joke keeps just coming.
The one joke.
The one joke. And with me is Sandro Iocolano, my boyfriend, Sherpa, set decorator, holder of my hand.
Sometimes.
Yep.
Yeah.
And this is interesting having you right in my head like this. This is bizarre.
Yeah. It almost makes, I feel like the headphones make it more official. And I feel like, what I'm saying really matters, you know?
It doesn't.
It doesn't
at
all. It just reverberated back into my head.
As a matter of fact, of all three people that are going to be in this room talking, I wouldn't say yours is the least important, but definitely ours.
Hours? You mean like hours of being the least important?
No.
Because that's me. Yeah.
And by the way, this is only going to go a little less than an hour just to our guests who we have not brought up yet.
Yeah.
But I'm super excited about this. This is the first time, A, that we've done headphones, and B, that we've done a remote location guest. And when they contacted me, I was like, hey, this is super cool. And it doesn't seem like it's AI trying to get a hold of me, which has happened to me numerous times since then.
Yeah. Sometimes they'll email and be like, hey, we have a great guest for your podcast. Just send us really quick. Just send us your social and your fear and the list of your fears and your daily schedule. And if you have how many locks you have in your apartment, but we have a great guest for you. And then anyway, 2 apartments later. Yeah. I've got them all supporting me now, though, so that's fun. That's hilarious.
So we can get some sponsors up in this bitch.
Yeah. I dig it.
What's that? Yes.
Yeah. Exactly.
Glad I could, put that out there into the universe.
Yeah.
All right. Well, why don't we bring her out?
I'm excited.
Okay. So obviously it's a woman. I'm not sure if you're going to be seeing her as we're talking during this beginning part, but at any rate, because we haven't done this before, I wanted to bring her out. This is so exciting to me. I just wanted to make sure I get it right. She's a board certified plastic surgeon and the founder of DMR Aesthetics. And by the way, tonight, we're going to be talking about labioplasty.
Okay.
So coming to your screen and not our couch, give it up for Dahlia Rice, Dr. Dahlia Rice.
Hi, I'm doing well. Thank you so much for having me.
Hey, my pleasure. This is super cool. Tell us a little bit about, tell everyone about your background just for a second before we get started so we can rope everybody in with interest.
Yeah, so I actually am considered a non-traditional surgeon. This is actually my second career. My first career, I was doing autopsies before I came to medical school.
Whoa.
And yeah, so I went completely in an opposite direction, you know, dead people to like, I love plastics. So the joke I always tell is that, you know, I went from wanting to work on dead people to people who are dead inside. So I did like surgery.
You work with a lot of comedians then.
Yeah. Entertainers.
Yeah.
Well, I'm one of 5 kids, so you gotta have some comic relief in that.
Oh my God.
I come from a big family, first doctor, so there's no medicine in my family. There's no education really. My parents were the first ones to graduate high school, so but I always had a love for art, beauty, symmetry, skin. I think that a lot of people go into this field not entirely knowing what they want to do,
Sure.
but the variety of plastic surgery is amazing. And it's just enough to keep my ADHD happy.
Oh my gosh. I know there must be so many different ways that you could approach this. And I'm still just hot autopsy person. What do you call an autopsy person?
An autopsist?
Sorry, autopsist?
I think that's the one, yeah.
She's like, yeah, that's it, Sandro.
Yeah.
Well, I mean, who doesn't want a person who, can solve mysteries, bury a body, and look good while you're doing it? I mean, it just totally makes sense.
I'm so glad we caught you because you're going to have your own show 15 minutes after this airs. And so we're going to be so lucky to have even had you. And your hair is amazing. And you would have looked so good on this couch. We decorate with lots of purple and things around here.
Oh,
yeah.
I remember
next time I'll have to come out and sit on this couch.
Please do.
Totally blend into it.
Yeah, exactly.
So, I remember I was going to say, I remember like the first show I watched on HBO, I think, was Autopsy. And it was with Dr. Bader, who had this very, very like soft way of speaking. And I remember the first thing he said was like, yeah, it was always like kind of like, and then the person had potatoes in their stomach. And I noticed the potatoes would have, and it was just like, I was like, oh my God, you can do that? And he was just so fascinated. And then I was fascinated that like this person had this job that was just like telling a story that the person who's dead couldn't.
That's amazing.
Yeah, it's fascinating.
It is so interesting. I never had a shortage of stories. And there is so much dark humor in dealing with that. But, being in your early 20s doing autopsies was so sobering because you got to see the parts of society that is kind of the dark corners that nobody really talks about. It was really, but the problem solving portion of it was fascinating. It was so interesting.
Wow. Did you solve a lot of crazy cases?
There was a lot, it was a very, so the county that I worked in Colorado is called Brighton County. It's a huge county. It's just north of Denver. One of my really good friends, she's still coroner there. My other really good friend is chief deputy coroner, who I worked with back then. And we would do like 350 autopsies a year. And you work a lot with law enforcement agents. And so it was always very interesting what people choose or, how things happen when you're solving crimes, like what that looks like. You learn a lot about ballistics and other things that, I've never shot a gun in my life, but I know a lot about ballistics.
I bet you do.
It's interesting learning those things and then coming into medical school and realizing that I'm actually a huge empath. And it was the stories that I brought with me that just were hard. Yeah, they were just really hard. And so when I thought about what I wanted to do for the rest of my life, I thought a lot about how I really enjoy making people happy. And I like seeing people very confident and being the best version of themselves. And so that really kind of helped me choose going from one field where I'm, allowing some closure for families into another one where I'm giving closure to some people who have maybe had a very, difficult time losing weight. And so now they've lost all their weight and they want to see the results. Or other aspects, maybe they've had multiple breast surgeries or they've always had insecurities about things that they want to take care of. And I wanted to be that person that they could come to and feel approachable and say, hey, these are my biggest insecurities right here. And that's hard. That's scary to do as a person. And so I really like psychology a lot and criminology, but a lot of the psych portion of it also comes into plastics. We learn not only how to operate on people, but also who not to operate on and who's a good candidate and who's not. And so the psych portion is a huge component of plastic surgery because
no, I'm sorry. I was going to ask you.
Struggle from it.
Absolutely.
Yeah. And I was just, I didn't mean to interrupt. I was just wanted to, I forgot about the delay as well. So I apologize. Is there something you do with like, do you have an evaluation that you'll do specifically yourself? Or is it like kind of meeting up with people to kind of get an idea if this person is maybe, let's say, if they're being hasty, or is it something they thought about? Is there anything like that you, or is it something like, more like in depth, like psychoanalytical?
A lot of it, for me personally, one of the reasons I decided to open up my own practice is because I really enjoy taking a lot of time with my patients. My consults will last over an hour. Wow. And so in that time, I learned about the patient's family and their motivation and their history and the things that really drive them to want to have these procedures done. And during those times, usually the times where you can tell, like, is this a realistic expectation this person has, or are they chasing something that's just not possible for their body? And a lot of times during that consultation, that's when those portions will sort of become teased out, because you want to make sure that if you end up operating on someone, that you're going to make them happy and you're going to give them the results that you promise.
That makes me think of, so if you're coming in for some sort of, whatever augmentation, whether it's your lips, your ears, or your boobs, and in this case, your labia, do people bring in pictures of what, and then specifically like with labia, and I want to get it more in depth with that too. Do they get like, here's a picture of one that I think is pretty, like,
Yeah. Well, at least I try to encourage people to bring in like what we call wish pics, because sometimes that also guides me into the reality of like, is this a realistic expectation or not? Like, is this a body type that matches this person? Is this an expectation that I can give this patient? And so if they're bringing in pictures that are completely unrealistic for their body, or they don't match up with my aesthetic, then that usually is a sign that we're not a good fit. And I tell my patients that if that is the case, that, I think that you may want to find a surgeon who, can give you the results that you're looking for, or this is maybe not the aesthetic that I align with. And so, because for me, I tend to like a more natural aesthetic. I tend to not like the over-exaggerated features. Thankfully, that is falling out of favor a little bit as well.
Yeah. Somebody wants to go ahead.
I was just going to say, I was wondering, I picture somebody coming in and being like, oh, I forgot my pictures of it, but I can draw it from memory. And like, almost like a tattoo artist that's like trying to trace or whatever. Mm-hmm. It's got to be like, because
sometimes people will try to describe it and you're like,
it's like, it looks,
like,
yeah,
exactly.
It looks like a roast beef sandwich, but like with like, I don't know, like how would somebody describe that? Like
in the buns, or is it pita pocket? Is
right.
it yeah,
exactly.
Hot dog in a bun. That's the one thing.
Oh, that's hilarious.
I want hot dog in a bun.
That's amazing.
Like, I want a pussy. That is what I've heard people say. I want this. This is what I want it to look like. These are the things that I'm looking for.
I love that you busted out the P word before we did. So that is amazing.
But people are like super.
Know I'm great.
Yeah.
People have to be super vulnerable at that point. So like, I figure like either you get people that are shy, or maybe they're like, no, I want a puffy pussy. Like they're just like, screw it, I'm here.
Yes.
This is what it is. Yeah,
you've gotten to that point. I mean, not you. One has, not him, but yes.
No, I don't, not yet.
He's been pushing me. He keeps saying that my vagina is way too big for my body.
Yeah, I'm like, I say it's too big for its britches, because it wears pants.
And it's very full of itself. Yeah. So what got you?
I know someone who can help you with that.
I know, and I'm
go.
looking right at her. Yeah. So tell me, what got you into, well, I mean, obviously when you study plastic surgery, I'm assuming that's maybe one of the things that they, but you have to pick your own specialties, right?
Right. And so when you're a medical student, you rotate through all the different specialties. And then at that point, that's when you're like, okay, it's sort of like speed dating. You spend like 4 to 6 weeks in each field, and you're like, okay, I like this, I like that. And so I always, whenever I'm mentoring young medical students, I always tell them, you have to find your tribe. It's the group of people that you meet along your path, and you're like, you know what, these people are amazing, and I want to spend time with them outside of this. They like the same things I like. Our personalities are similar. And so that usually tells you what field you're going to align with, because that's a personality type that's drawing you, and you're going to mess with a lot of the same people.
Right.
And so for me, in the field of plastics, I loved the idea that there's a lot of creativity with it. And so if I do something that's off the cuff a little bit, or something that's not super mainstream, or a little bit of a different of a variation of that procedure, then that makes me creative and unique. And plastics, the field of plastics rewards that. If I was in, general surgery and I decided some novel way to do a lap pulley, then people would look at me and say, oh, this is not the way we do it. And this is how it's been done for so many years. And so plastic surgery still have a lot of the creative aspect to it, because there is a large portion of, taking someone's ideas of what they're wanting and pictures and then creating that with a three-dimensional reference into what that looks like on their body. So to translate that to their body to make it match and work for them is a different skill set than some of the other surgical fields. And especially when we're talking about, manipulating someone's genitals, like that's a huge thing. And people are very insecure about that. And a lot of it depends too, like where I think phases of life make a big portion of that too. If people have had children before, these tend to be the people that I see sometimes that have had, either a traumatic childbirth, and so then they have problems with their labia because of that, or they're just naturally built that way. So in general, when we're talking about labias, the average size of our woman's labia is 4 to 5 centimeters. And that length is pretty long when you think about it, when we're talking about going from a length of 4 to 5 centimeters down to 1.5 centimeters when we're doing a labiaplasty.
Is that what your goal is?
It depends on the person, but in general, because you want it to mimic that kind of gentle curve that has a natural labia too. Some people need a clitoral head reduction, others don't. It depends. Everybody's, labia are so different. The majora and the minora are extremely different. The comparison between them, who has more clitoral head tissue, who doesn't, and a lot of those things are super different depending on the patient. But one of the things that I do tend to see is that it is the patients that tend to have the longer labia that get twisted, irritated whenever they're, trying to ride a bike like a Peloton, or they're trying to exercise. The labia can get twisted, can get folded. Sometimes they suffer from yeast infections because there's not enough airflow. Right. And so those things all contribute to the reasons why people get labiaplasties. It's not only cosmetic. Like, people don't oftentimes come in and just like, oh, I want a pretty pussy, that's why I'm here, right? They oftentimes don't come in because there's some functional problem to it, that either they have too much redundant tissue and it does affect them sexually. So labiaplasty has been shown to increase rates of sexual satisfaction as well. And so sometimes that has to do with the redundant tissue, causing it to be a little bit more difficult to experience sensations, unless you have, someone who, the biggest question that everybody always asks is there going to be a change in sensation? Because obviously that's super important. And I tell my patients a lot of times, with any surgery, sometimes a surgical scar itself can have poor sensation, but for the most part, some people will actually get hypersensation from it afterwards, especially with the clitoral head reduction, because then they have just more exposure of the clitoris, and that makes a huge difference for women's sexual health.
I love that. It's just so much easier to take a look under the hood now.
What, right.
That's right.
When the latch is already popped.
The latch is popped.
It's already there. It's ready to
Exactly.
So like, would you say that your patients are, would you say they're like half and half? Like some of them are like, from, like you said, from traumatic births or something like that. And some of them are just born that way, or what would you say is more common for you to work on?
I think it's probably more common to see people have a variant of normal, is what I like to call it, because it's not abnormal to have larger labia, and different ethnicities will have different size labias, and everyone's preferences are very different too. And so, some people want a small reduction of their labia, some people want a more aggressive reduction of their labia, some people, because it really just depends on the person and how it matches with their body. But a lot of times that really, I would say the majority of people that come in primarily have some variant of normal. So they have not had a traumatic childbirth necessarily, but, childbirth itself can create that, some abnormal adhesions.
Oh, yeah.
But for the most part, a lot of these are kind of more, I would say that the people who've had some of those traumatic childbirth experiences are oftentimes people who've already had larger labia. They get either degloving injuries or some sort of situation where the tissue scars and then can cause twisting or irritation of the labia. And so that can also be part of that. So they can actually have both, some normal variant plus some trauma situation that occurred.
Yeah. Oh, that's really interesting. I've seen pictures where they just show like vagina after vagina after vagina, like looking inside, and they all look weird. I mean, you know what I mean? Like nobody's looks better or worse to me. Like it's just like, oh, I could see why that one would work, and that one works for this, and this one looks cute for that person.
It's like a family photo album. It's like not everybody looks weird, but I'm just used to them. But to somebody else, they must look bizarre. Yeah.
That one artist that did like all the different like labias. They did all the impressions of all the different vaginas, and there's so much variation within it. And so again, a lot of it depends on the person. And you know, when you're looking at this, especially from a scientific aspect of things, you know, this is so funny because like during my training, and it's a similar path that you go down when you're talking about very specific, like very little minute details. Like, so, you know, whenever I'm doing top surgery, when we talk about nipple sizing and male nipple position, like that's a huge part of that surgery, right? Sure. And so whenever we're talking about labiaplasty, like the variations can be huge within the population. And so that's another reason why it's extra important to sit down and have that conversation with the patients to figure out exactly what they're really kind of envisioning for themselves. And to also know that people will scar differently. Some people their scar contraction is going to be a little more aggressive, and then they may end up getting what we call a Barbie deformity, which is exactly what you think of when you think about Barbie's vagina, which is essentially non-existent. So that's one of the deformities that can occur, and that's probably the most common complaint is just too aggressive of a labiaplasty, and then you end up with this what they call the Barbie deformity, where it literally is just nothing.
It sounds like you're probably someone that's not going to get. I feel like you would go less rather than more with a patient, as opposed to like just let's just, you know, just start throwing it out there.
Like, you look like a Ken doll now. What? What does that mean? Yeah.
Right. Well, it's like a haircut, right? I mean, you can't add more on after you've taken it off. So you really got to make sure that you measure twice.
Yeah.
Cut once. It's so funny.
So is there, now when you're doing.
Sometimes you got to go back and trim it up. One time looks different than the other, you know. It's like bonsai tree, you know, just like, you know, going back and a little bit.
So you like take a step back, like while you're all like in your gown, and you take a step back, all covered up and everything, and you're like, okay, yeah. And it needs a little something. So then you have to plan.
Trim off the top.
Yeah. So then you have to plan for what it would be like after it swells, or what it would, how it could potentially.
So fast.
Okay. And then you have to plan for like how it's scar.
Yeah, exactly. The local numbing medicine, I mean, it swelled like that. So you almost have to remember what it used to look like so that you can then make sure that you complete the procedure, you know, in a time frame where their swelling isn't so severe that it makes all the tissue look abnormal. But yeah, that is true.
Does the local anesthetic make you swell faster than other anesthetics?
We always use local anesthetic, whether it's in the operating room or in the office. It's pretty common that we do labiaplasties actually in the office under local numbing medicine. Okay. We actually can do a really good job with that. If you give it enough time, it helps a lot with the blood loss and the bruising and the swelling afterwards. So people are less likely to get hematomas. They really got to give it the full 21 minutes, which is an awkward 20 minutes sometimes. You know, because the patient's there, we're waiting. And so I oftentimes will set it up so that we're doing things in succession. So we're always moving. The patient is always comfortable. The patient always feels that they're being, that we're being very sensitive to their any discomfort. Obviously, it's, you know, when you're in a field like this, you know, a lot of it, and we leave modesty at the door sometimes with that. And as women, I think I can't imagine having that procedure by a male physician, because as a woman, I'm not sure that they would understand what it's like. And so for me, I can acknowledge how my male colleagues can do this as well. But I, as a female, that would make me feel more comfortable. It's not like having a woman OBGYN versus a male.
Yeah, I don't want a man's opinion on what. Yeah, I don't want a man's opinion on what it's supposed to look like. I want my own opinion. Right. But did I get it right? It only takes 20 minutes. Did I hear that correctly?
Yes, it doesn't take that. It can take, well, it depends on the amount of resection that we have to do, but it takes 20 minutes for the local numbing medicine to really kind of kick in.
Oh, so I see what you're saying.
Once we do the injection, we let that epinephrine really work. So we got to give it the full time. But the procedure itself can be as quick as 20, 30 minutes. It can take an hour and a half. Again, it depends how much bonsai tree trimming I need to do.
Wow, that's
because I'm a perfectionist. And so, I will go back and forth until I feel that there is the, perfect amount of symmetry.
Gotcha.
Because a lot of times people will have just in general asymmetry at a baseline.
Well, I mean, we all have asymmetry. It's like even with eyebrows, it's like they say they're sisters, never twins, and sometimes they're cousins,
That's
you know?
right.
So I'm sure it applies to pretty much everything.
Yeah. Mine were
For sure.
the same person for a long time. 'Cause
Which
they used to have
the
the hair
eyebrow-
right here. So they were like, and then it was like, oh my God.
These
They all
two.
conjoined
It's a-
twins.
Yes,
Yeah. Yeah.
exactly. That's
Yeah, I
perfect.
had to get rid of the, get out of here. So when you're saying bonsai, now you're saying that when you make the cut, it will grow back. Right? So
Well,
it'll
a lot of
eventually,
times when well, yeah. So skin laxity, like the reality is no matter how much tissue laxity we remove, it's like inevitable that it always comes back, right? And so you will regain some of that laxity. And then the other thing I think too is that during the labiaplasty and the post-operative recovery period is there's a bunch of hand-holding, right? Because people come out of surgery, their vaginas look crazy. They're so swollen. Sometimes they can't even pee afterwards. And that's one of the big things I talk to people is like, if you're so swollen that you're not able to go to the bathroom, that you can't pee, you're going to have to call me right away because that's not normal.
No.
But some people will get so swollen. And so I tell people all the time, you got to get your pelvis up. So get a wedge pillow, get the pelvis lifted, and then ice, lots of ice. So ice after ice after ice. And so my ladies who've had babies know that you can take newborn diapers, wet them, put them in the freezer, and there's a perfect ice pack. And so I will tell my patients about
that's a great idea.
Or
Yeah.
diaper inserts.
I like that. Or you could freeze like a can of beer and stick it in there and then just put it, I mean.
Yeah.
Yeah. I remember you, yes.
Pour it out for your homies. One for you, one for your vagina.
Exactly.
You're-
It's hilarious. What were you going to say?
I was going to say, you did that once with I think it was a THC soda.
With a can?
And yeah, you had like, because it was in the freezer. And I
We
was
were
like,
having
that's-
sex a lot, like, and for long periods of time. And, and like it hurts. And yeah, we did we used a can of something.
Yeah, it was. I think it was WD-40. I think it was a can of, but it was in the freezer for some weird reason. But
WD-40 in the freezer?
No.
That blown?
yeah, I won't do it
Probably.
again. I won't do it again. It made things a little weird.
I have a question for you because this is called sex, drugs, and skincare, and like this is not really like the normal kind of skincare, but I mean it's obviously skin. Do you find that
It's
there's
care.
and it's care for sure? That's definitely
It's skin
care.
and care.
And sex.
Oh, and sex and
That's
drugs.
right.
We hit all three.
We're good. I think we're all good. Yeah.
But does the skin react a lot differently down there than it does anywhere other, in any other places on the body?
Really good point that you bring up. This is what we consider a privileged area, similar to inside the mouth, the mucosa that is created that the vagina has, and the mucosa lining of the labia minora in genitals specifically have great healing properties. The patients heal super fast. They also tend to be patients that don't have as many wound care issues as other locations. They heal extremely quickly. And so that's one of the things too that I have to make sure that I tell my patients about is that you're going to heal very fast. Typically, if we have sutures, I will leave the knots on the outside actually. So I have to trim those knots typically at 1 week. But even by 1 week, they're already trying to like grow into the skin. And sometimes I have to unroot them to get them out. So it's like they heal so fast down there and the patients do so remarkably well. People think a lot of times, labiaplasty is barbaric and horrible recovery and all these things. But the reality is actually the recovery is super easy. And I tell my patients, look, if you can have a baby.
I was just going to say that.
Just pop out like a 10-pound baby out of your vagina. They send you home the next day with this newborn and some ice on your vagina and call it a day. Like these women do great. After labiaplasties, they have no problem. Like within a couple days, within 5 days, the swelling goes down significantly. Patients are moving around fine. It's not really too much of a downtime for this procedure. And there's really not a lot as far as, side effects necessarily. Like these are not the type of things that you're going to see in other locations. Like I said, the wound healing issues. The biggest thing again is patient selection. So patients, you want to make sure patients aren't smokers because nicotine can affect wound healing significantly. But really in general, the labia is just, it's like it is such a privileged area and they heal so well.
I feel like the vagina itself is just a health. It's like it's just a self-cleaning oven. It's a self-cleaning everything.
Right.
It's made to be, it's made to take a lot and then to grow back really quickly.
Well, yeah,
Right.
That's where life comes from. I
Right.
think.
You think? Yeah.
But also,
We haven't had the talk yet.
I don't. Yeah, I don't want. I told her, I don't want to know. But I think that
mom and dad love each other very much.
yes. Then they get a divorce, and you come. What? That's weird.
Right.
But people that call it barbaric, I feel like are misinformed because I don't know many barbarians that can do plastic surgery. I don't know of any barbarians out there that had the force, or even could have like the instruments. They just had like rocks.
Right.
And I think it's bullshit because people just hear one thing and they're like, "Oh, you're altering the body. Oh, it's part of the body where we're not supposed to talk about." And then their beliefs come in, which is probably something instilled from, other family members and barbarians.
Yeah.
Right. Well, and I mean, I think it's very equivalent to what we talk about in male circumcision, right? Some people view it as barbaric. Some people agree with it. Some people don't. Obviously, in the United States, like the majority of males have circumcision, or those born with penises have circumcision, but you go to other places and they don't. So it really is, again, it's a personal preference more than anything else.
Would you say that the skin heals faster on a woman or on a man? On a circumcision?
Question. Well, I mean, in general, the majority of the circumcisions are done on newborns, and newborns are like basically like newts. You could like cut off an arm and they would regrow it. Like these kids are amazing. Like, literally, like I don't understand. They are like, as we age, it's just goes way downhill.
Yeah, exactly. It takes a lot longer for your hand to grow back, but yes.
That's the worst.
Yeah.
Right.
But I mean, like if a man comes into you and says, "Listen, I didn't get circumcised. Can you do it now for me?" Is it like just as painful, just as complicated? Does it take longer to heal?
I think they're just a lot more whiny more than anything else.
I love you so much.
Yeah. I had one at 22.
I didn't want to bring it up. I wanted to.
I didn't think I'd be bringing it up. But
yeah,
here we are.
I think it's great.
No, it's fine. I don't care. I had one at 22, and it took about 6 weeks. But it's also different because every morning, as a guy, you have to pee so much that you're like, that it hurts, and you're like, I gotta go. So it was really bizarre. I was like, how is this but I guess the stitches were fine and it did have a little bit of pain, but it wasn't a lot of whining though. You're right. I did whine a lot.
I'm not surprised.
Yeah. But,
the thing is too, is the adhesions, like with the circumcision, like it tries the adhesions try to come back. And so you have to like remove those, make sure those adhesions don't form.
Right.
And that is probably more uncomfortable for men than it is for women because we don't necessarily like remove adhesions around the clitoral region. Yes. And so for men, like you have to make sure that those adhesions don't form. And so that is pretty painful. But I will say that the labia minora can also have adhesion problems. They just don't seem to be as uncomfortable for women. And maybe it's because we're like mutant superhuman strength, like our pain tolerance is so different, right? We talk about insertion of IUDs as women, and we're finally getting pain meds for that. And we're told for many, many years, oh, the cervix doesn't even have nerve endings. And so it's pretty fascinating how as women and girls in general too, at very young ages, like we have long hair. So, I remember, growing up having a brush like ripped through my hair. So we're started at a very young age as women dealing with pain at a very regular level. And so it makes sense why women can tolerate it better than men.
That's insane though, I didn't realize that we were supposed to it's like when you say that animals don't have feelings, like, yes, my cervix has feelings, like big time feelings. I've known, you have anything put in and out. I had an ectopic pregnancy. And so they went in and out of there to do like some testing and do some stuff. And I've had in vitro and I've had a lot of stuff happen in that area. So like, I know that it hurts and it feels awful.
Oh yeah. horrible, but yet it was not talked about. Like women's health in general was not talked about. And I think that's why we're seeing so much more labiaplasty like on the forefront, because we're finally talking about it. Like people can say vaginas without blushing. And, now we're talking about these things and making it more of a normal conversation, because it should be.
That's really cool.
Yeah, I think it should be normal because, the more you know about this kind of stuff, the more you can help, the more you can kind of, it's all other people's lives as well.
What do you
It's
mean?
like your partners, like who you're with, the more you kind of, open it up. I don't know. It just makes sense. But I get it though.
Absolutely.
But also, penis and vagina are really stupid words. It's like you got to make them cooler.
I think vagina sounds cooler.
I think one day people will think of different words for them.
I mean, they thought of so many different words over the years, like, and so growing up, in our era, it was like, we don't really use those words. We use like, not really anatomical words. And we're talking about it again, like the birds and the bees conversation, right? Rather than having like, real conversations. I'm 42.
Yeah. Yeah. That's hilarious. Yeah.
What?
So growing up in that era,
totally.
I'm like, hey, we don't actually talk about those things. We don't learn about women's bodies. In medical school, we didn't really learn about these things either. And so a lot of these things, I remember sitting in my conferences as a resident, hearing my attendings who, primarily male, because currently there's only 1,400 female plastic surgeons that are board certified in the United States. And that's increasing, but, during my training, it was not that high. And so there was conversations during our conferences to discuss, do you reconstruct this person's vagina or not who had cancer because it's a vagina and they're older, they don't really need it, right? But if we were talking about a penis or testicles, like you best believe we'd be pulling out all those stuff.
Yeah.
Make sure we reconstruct all of them.
If you're doing implants.
Right. Oh. Right, exactly. And so those conversations are switching a lot. We're having a lot more conversations about women's health, what bothers women. We're not expected anymore during perimenopause, menopause phase to go out in the woods and just, die. and so like there is a huge push now on the forefront because, women in general, as we approach the middle ages,
middle age.
And it feels like the Middle Ages. I tell you,
it's true.
And as we're approaching the midlife years, that's the time where we see a lot more skin laxity, and that's definitely probably the time where I see the majority of people come in. Is right in the 30s and 40s.
Gotcha. I was going to ask you that.
The fact that they say birds and bees, I remember it popped into my head again. I remember thinking like, do the birds have sex with the bees? Like now you're just confusing me. You could have just been like, where babies come from.
Yeah.
But the birds and bees was like, okay, now I have more questions and it has nothing to do with anything. So come on, parents. Right.
It's just like, exactly. It's like the stories, it's like the
what will the neighbors think?
Right, exactly. Shot. Yeah. Clutch your pearls. Oh my God.
I love the pearl clutchers. Yes.
Somebody's after them.
Oh my goodness. I wanted to ask you a question. Do you use filler ever in that area, like in the vulva or in either in the labia or vulva?
Yes. So for labia majora in general, especially during the perimenopausal phase, a lot of women before they become menopausal will start to atrophy in those areas. Some women just don't have a lot of cushioning in their perineum, makes it super uncomfortable for them to sit for long periods of time.
Sure.
And so, bulking up some of the labia majora with filler, but filler is not permanent.
Right.
So that always ends up becoming the question is what, do you use filler or do you just use fat transfer at that point?
Right.
Because sometimes, that area, adding some fat grafting to the region can really help round everything out so that it can, again, have more padding because we lose a lot of that when you think about during that perimenopausal phase with the atrophy that occurs when we're losing those fat compartments in our face.
It's happening down there too. Yeah. It's that subcutaneous fat layer. Thanks a lot, nature. Jerk.
Except on the other side, men end up gaining more weight down there. So, I mean, their mons area tends to just get a little bit more fatty, as is what I've been noticing. So I see a lot more males come in for liposuction procedures.
What's the mons area? Is that like their vulva?
Yeah.
That's
the
that's Le Mans.
Pubic, the mons, the pubic area, exactly. Okay. So that right above the penile shaft will tend to have a fat pad there, and so that fat pad will sometimes gain more volume in men as they approach that, kind of midlife era.
Maybe you could give me your fat to put from your mons into my but I'll take
oh my god from my mons from my from my mons to your Venus.
That's right. Yes, thank you.
That was a strip club in Tampa called Mons Venus. I just
really
no.
I'm
sure it's burned down by now. It was a shithole. But that's interesting how that happened. Is there like a evolutionary? Is there like a reason why that happens?
Which part, the thinning or the thickening of
both? I guess the thinning and the thickening of it. But I guess both of it. Is there?
Yeah, a lot of this is related to hormones, right? And genetics. A lot of this comes back to that. Your body, that area in general, is so sensitive to hormones. And so when we're talking about that common, for women, especially, even at a postpartum period, using intravaginal suppository with progesterone to help, increase the lubrication. These are the things that people are finally starting to talk about, because preventing the atrophy from happening in the first place before all the hormones start going crazy is a huge part of this. But for why this happens to males, I don't really know that answer. I think a lot of this, again, has to do with the way the body changes over time, because men, as they get a little bit older, and again, this tends to also be, has to do with genetics. They will gain weight along the midsection, that spare tire, and with that comes the mons area.
Right. Fatter, for women, hunching over, men.
Visceral fat.
The visceral fat on the...
Right. Yeah. Right, because women will get that too, but in general, the genitals are so sensitive to hormone shifts and changes, which makes sense. But at the same time, that is a large component of why we're losing fat in that area, why there's atrophy. People will get an increased risk of urinary tract infections because of the loss of some of those hormones. So really kind of looking at everything as a whole, not necessarily just like trimming the bonsai tree and calling it a day. It's more about the fact that we got to get the skincare in there too. So now they're creating sexual lubricants that have hyaluronic acid in them.
No way.
All kinds of other cool stuff. Oh yeah.
Oh, so, I love that.
One of the skincare brands, Necessary, that company makes a hyaluronic acid.
Necessary. Okay. We'll put a link to them in the comments so people can find it in the description, so that they can feed that. I wanted to ask you about atrophy, if you don't mind. Is there a way to prevent vaginal atrophy? I can't say it. Vaginal atrophy.
You did good.
I did. Okay, thank you.
Yeah, it's a tongue twister.
yeah. That it is.
So a lot of that's going to be related to hormone replacement. And so when we're talking about hormone replacement for women in particular, we're not talking about necessarily hormone replacement systemically. It can be local as well, which, because one of the things we talk about with women, obviously, one of the risks or concerns is always, does the hormone replacement therapy increase the risk of cancers, like breast cancer specifically? And so what we do know is that women can have a more local effect without the systemic effects of the hormones. So they can still get the benefits of having that suppository, the intravaginal. Thing is too is that the vestibule also needs testosterone sometimes as you get a little bit older as well. Like there's so many things. And so going to a gynecologist that specializes in perimenopausal menopause medicine is going to be huge for that time frame in a woman's life. And so I always joke that during the times that when we're younger, we want an OB that's really good at delivering babies. But when you get into your 40s, you need a gynecologist who's a really great surgeon and understands hormones really well.
Yeah, definitely. Yeah, I mean, if I were going to have a baby in my 30s or 40s, I would for sure want to come out of there looking spick and span, and I deserve it.
That's right.
Yeah.
Yeah.
Absolutely.
That's a good push present. Yeah.
New car smell, everything. Yeah, totally.
Right.
Wow, this has been so informative. I'm like, I don't know. I'm just blown away. When you guys contacted me, I was like, labioplasty. Like I said, I was thinking about it, and then instantly I was like, yeah, because there's skin, and it's not something I've really thought much about. So, yeah.
But it's also it's fascinating to me on the side that like you really don't know what it is until you, I mean, obviously research it, but then everyone has so many different reasons, all different walks of life. People come in there, and I also like the fact that like even if somebody comes in there because it's purely aesthetic, so what? Like it's like we do everything to ourselves in every way. We have no problem telling people we're on diets, which is physically altering ourselves. So I mean, you know, and people do research on it. They don't just come in and go, do it. Don't talk to me about it. Like,
right. You're absolutely right. Or people have been thinking about it for many, many years. They feel a lot of shame with it. And so coming in and talking about it is a huge step for those patients. Because again, you know, you don't want to, you know, come in and feel shamed for something. And I think that having those conversations, more people being out there talking about it, normalizing this procedure is very powerful for a lot of people, because this can create a lot of discomfort for women that we just don't talk about as women. There's certain things we just don't discuss. And for the longest time, that was part of it. And I talked to so many women, and a lot of women don't either know about it, don't know that was an option, didn't realize that labioplasty was a thing, and that it can be done in the office under local with minimum downtime. I think that's the other part, is people are really scared of pain. And
for sure,
this surgery is not a super painful surgery for most patients.
Relatively speaking, in terms of cost, what would you say? Like it's more on the high end of, you know, like cost wise, or a little more towards, you know, or in the middle, I would imagine, depending on what you're comparing it to, I suppose.
Yeah, this procedure typically will run anywhere from $4,000 to $8,000, depending on the geographic location,
Sure.
right? Because if you're in a higher cost of living, it's going to be more. But a lot of it will depend on the anesthesia. Some people don't want to be awake for this procedure, and that's totally fine too. Yeah. So it's going to be more expensive because the anesthesia is more expensive, and that has to be done in the operating room. And so there's various levels of numbing and anesthesia that we can use depending on the person, so we can tailor it for them depending on if they're too anxious for it, doing it in the office, or it's just not something that they want to do, or they combine it with other procedures. And so that tends to be one of the things that I do the most, is it ends up being combined with other procedures. Not as many people walk in saying, oh, I just want a labiaplasty. A lot of people will have multiple things that they want to have done at the same time.
What's a good combo that somebody would come in and ask you for?
So a lot of the combos that I tend to see are going to be body contouring based things, tummy tucks as well. And so with that tends to be kind of more like a lot of the 360 lipo, high def lipo, some fat transfer into labia majora, and then labiaplasty.
And those work really well together, obviously, because you're taking out fat. But are you taking out like the pad, or are you taking out just the fat and putting? I don't understand how fat transfers work now that I think about it.
Fat transfer is so magical. Actually, it's pretty cool. So. The way that works is that within your cells in your body and your fat cells, there are stem cells. And those stem cells can be certain things. They can only be a handful of things. So they can't be every single thing, right? And so one of the things that they can still be is fat cells. And so we take those fat cells, we process them, meaning that we wash them, and then we re-inject them into an area. And we know that if we inject them into a region, that the stem cells will actually set up shop, and then they will start making, they'll retain there and then make their own fat.
It's so cool.
And cool. The fat cells in the body, we learned a lot of this during breast reconstruction. We do so much large volume fat transfer, BBLs, things like that. So we're learning so much more about the power of fat transfer. We're doing a lot of fat transfer to the face nowadays too, because we're finding that it not only does it replace volume, but it also helps with skin quality. It stimulates collagen production. There's so many good benefits to fat transfer. And it's your own tissue, which is huge.
And it's probably not a lot of adhesions underneath the skin if you're doing, like with fillers. I guess it's been more in the sort of in the news, like, like they're seeing like adhesions underneath where the fat doesn't, where the filler doesn't necessarily leave, but it's your fat.
So with that, it has I see less complications from that. The biggest downside is a fat transfer that looks like it can be unpredictable. Some people will retain fat really well, others won't. And so that's our biggest problem that we have in plastics is that, because I do fat transfer to the breast as well, that is actually a very popular breast augmentation technique that I use for a more natural augmentation, because breast is primarily made of fat. We have fat everywhere in our body. And so that is, that's the biggest issue, is that the fat transfer can be a little unpredictable. We know we probably will lose 30 to 50% of it over time. And so sometimes I retain 80 to 90% of it. And so it depends a lot on the person and the techniques that you use. If you have a gentler hand, you are a little bit more conscious with the fat cells, then you get better take.
I think of all those times my uncle was like, do something about your fat head. And I'm like, oh, and I was like, no, it's like, oh, I can. I can literally remove fat, or I can make it fatter. He didn't say what to do with it.
That's right.
Yeah. All right. That's
you should have been more specific.
Yeah.
Well, this has been super cool and so informative, and I'm so glad that you guys reached out and that I'm just, thanks for coming on our show, and just I don't know.
Gosh, thank you so much.
Oh man, this has just opened up a whole new world of questions and topics that I want to talk about, and we'd love to have you back sometime.
Oh my gosh, I would love that. There's plenty of things that we could talk about.
I love that. Yeah, go ahead.
I was going to ask you before I ask you where people can find you. I was going to say, is there anything that you'd like, I don't know, women to know, that something that you would, something you want to share with them even before they come in? Or is there something, like that, because you talk about normalizing it and making it more comfortable for people if they're feeling vulnerable. Is there something you wish you would have known, or something that people can kind of get, before they come in, or if they're thinking about doing it?
And I think the biggest take-home message that I have for most of my patients is, take that step. If that's really something that you're interested in, if that's something that truly is bothering you, then find someone that you feel safe saying that with. And that can be, make sure that you do your homework. You want to see a board-certified plastic surgeon, someone who is a specialist that does these things on a regular basis. And so going to see them, feeling comfortable with them, getting to know them a little bit and their aesthetic before you come to see the surgeon is a big part of that, because fit is important. And that's what's going to make someone feel really safe. If they can connect with you, they feel heard, they feel like they've been listened to, they feel like they're what they want is being listened and heard and spoken back to them in a way that they understand and that we can comprehend, and we're speaking the same language, basically. Because that's what it is. Medicine is its own language, but I have to be able to take that. But as women in general, we all have the same insecurities. We're always either too thin, too fat, my leg is too big, too small, too this, too that. And so, we're always on that spectrum of chasing something or having an insecurity that, because our bodies are always on display as women. And that tends to be something that as women in general, I think people see other people and think, well, they don't feel that way, or they don't have those insecurities that I do. And the reality is that we do. We all have the same.
Oh, we really do.
Mm-hmm.
I'm sorry.
Yeah.
Yeah. So I was going to say, and this actually ties in because where can people find you on your social media and whatnot?
And I'm on Facebook, so Instagram and TikTok at Dr. Dahlia, br.dahlia.rice.
Okay.
And so I'm primarily, depending on the algorithms, but Instagram tends to be the one that likes my content better. So, but I'm on both those platforms. Then you can find my website at dmr.aesthetics.com. And if you're in Chicago, you can find me in Wicker Park neighborhood, which is a really cool neighborhood in Chicago. Next time you guys come to Chicago, let me know. I'd love to host you.
Dude, we're going to go to Mars Cheese Castle and we're going to hit you up right away.
That's in Wisconsin.
It wasn't. It's between the two airports, though.
Well, yeah. Oh, man. I'll go to the Mars Cheese Castle. You might as well get Apple's Way there, too. Right next to it.
I love that you knew what I was talking about. Yeah.
I knew exactly. Well, I was in Wisconsin for 3.5 years, drove by that Mars Cheese Castle every fucking day.
Oh my gosh. All right. Well, thank you again. And let's stay in touch. And this Great. So you guys have a great, you guys in land of the podcast land. And then this will be out probably this coming Wednesday at 3 a.m. And I look forward to watching it myself. Yeah. So thank you again.
Thank you so much.
Great time. We'll do that. I would love to come to you in LA as well.
Absolutely.
Definitely.
Please do. All right. Well, you guys, everyone have a great day, and we'll see you next time. All right. Bye.
Thank you.
Yeah. Thank you.
Bye.